Good morning, everyone. Welcome. Welcome to Early Care Connection. I'm Izzy Greenberg. Today we are joined by our resident panel of experts, Meryl Gay from the Connecticut Early Childhood Alliance and Ava Bermudez-Zimmerman from Child Care for CT. We will have updates for you from both of them after our main presentation today, which is a presentation from CT359 and partners on early literacy. It should be great. We are being joined today by Allison Logan from CT359, Susanna Holtenbeck from Read to Grow, and Alex Chu from Reach Out and Read. So I am going to turn it over to Allison. In a few minutes, I will also share the PowerPoint in the chat for you all. And of course, as a reminder, we will post the recording and documents within the next 24 hours. If folks could also do me a favor and hold their questions just to see if it comes through in the presentation. We will after the presentation we will do Q&A with our panelists. So Allison, welcome. Everyone, welcome. Thank you for being here today.
Thank you, Izzy. Thank you, everybody. Thank you for joining us today. So a little bit about CT359. I'm Allison Logan. I am co-founder of CT359, which was launched in January 2023. We are a network of individuals and organizations focused on the health, well-being, and early success of Connecticut's younger children within the context of their families and communities. We gather, analyze, prepare vital information on outcomes at birth, 3, 5, and 9 to help people, organizations, and government make sound policy and resource decisions. One of those ways we share information is through our Grand Round series. And we've had several Grand Round series this year, and this one we're very proud to have on our Grand Round Susanna Holtenbeck from Read to Grow and Alex Chu from Reach Out and Read with a Grand Rounds around early literacy. So welcome, Alex, welcome, Susanna, and I will turn the floor over to you.
Before you all start, would you also just mind describing what Grand Round is? Because I don't know that folks not in the medical community are even aware of that term, which is kind of a hospital-y term. So maybe you could just say that before we get started.
Sure, it is a hospital-y term, and Grand Rounds is something where they pull physicians together in a hospital and do education and professional development, and they talk about things that are happening in the hospital arena. And we first started doing that because a lot of our focus in CT359 is around the medical community, what's happening in the pediatrics, what's happening in the hospital setting. And I know Susanna is very familiar with the hospital setting and Alex is very familiar with the pediatric setting. So you're going to be hearing a lot of things around the medical sector today. And the reason why we're so happy that it's on Early Care Connection is thinking about how we bring the early care sector together with the medical system and really looking at where those connections are between early care and education and the medical system. So thank you, Izzy, for letting me explain that. So I will now turn it over to Susanna and Alex.
Good morning, everyone. I hope you're well, and thanks so much for joining us. We're really excited to talk to you all today about building equitable literacy opportunities across the state of Connecticut and thinking about where those overlaps exist between the healthcare and the pediatric community and the early child care community. Meryl, Izzy, thank you so much for hosting us today. Allison, Logan, always a pleasure to see you, and thank you for the introductions. Izzy, will you be presenting the PowerPoint, or do you want us to throw that up on the share?
I think if you can, it'd be easier because I'm working to get the translation done. Yep. So if you can, thank you. And folks, I will have a Spanish translated version of it for you in about 2 minutes. Just a reminder that it's translated by a robot. It's not perfect, but it'll be pretty good.
All right, I'm going to give this the old college try. And bear with me because I am just on a laptop today and it's not my best. Hopefully you should all be able to see my screen at this point, which is building equitable literacy opportunities in Connecticut. So we've done our introductions today. Again, my name is Alex Chu. I'm the executive director of Reach Out and Read in Connecticut. And I will share with you all, because we're talking about literacy today, that my favorite children's book is Corduroy. Susanna, do you want to introduce yourself?
Hey, everybody. Susanna Holzenbeck, Executive Director of Read to Grow. I have two young kiddos who came up in early childcare in Connecticut and also received Read to Grow books in the hospital. So really excited to share both my personal experience, but also my work with Read to Grow today with my wonderful colleague, Alex.
Thanks so much. So we wanted to do the share with you a little bit about where we're headed over the next 45 minutes or so. We're going to introduce what we do at Read to Grow and Reach Out and Read. We're going to talk a little bit about why early literacy is the agenda item for today, and why brain development and how brain development plays a role in early literacy, but also positive and appropriate development for early children, for young children. We're going to spend some time talking about the connection between healthcare and the childcare realms in early childhood, and how Reach Out and Read to Grow serve as a bridge for some of those pieces. Susanna has an incredible resource for us in some of the data maps that Read to Grow is doing for their statewide data hub. We're going to talk very briefly about some local and some national funding and policy updates, specifically within the realm of literacy and how we are looking at some of those opportunities and challenges and how some of those will affect this work as we move forward, and talk a little bit about some ways for people to plug into this work. If we've got some time at the end, we'd love to spend some time answering some questions from folks in the audience as well. So let's go ahead and dive in. Susanna, why don't you jump in?
Thanks so much, Alex. So, Read to Grow has been around for 25 years. We just celebrated our 25th anniversary this year. And the organization started at Yale New Haven Hospital. The founders were handing out books to new parents right on the maternity floor after they had their babies. And that core of our work continues today. Our mission is to promote language skills and literacy skills for children beginning at birth, actually now prenatally, and to support families as their baby's first teacher. And so we can go to the next slide, Alex. We have a vision of every family appreciating the critical importance of early literacy, engaging in their child's reading development, and envisioning a Connecticut where all children have books of their own at home. Next slide, please, Alex. And actually, maybe I'll share this link, unless actually if you're able to open it and scroll. And then when we get to the data maps, I'll do that part. So if you can just scroll down. Okay. So we have a little graphic here just to show you the continuum of services. And while this is a Read to Grow graphic, I want to be clear that actually Reach Out and Read is represented, maybe not by name, but in partnership here. So, early literacy starts in the womb, right? Babies can hear. We'll get a little bit more into that in the next portion of our presentation. But the work of Read to Grow and Reach Out and Read, it really starts even before baby arrives. So Read to Grow is partnering with multiple clinics around the state. And so families that are expecting babies receive books even before baby has arrived. They receive information about brain development and bonding and language development. And then once they have their baby, if their baby is born at one of 19 hospitals that have birthing services in Connecticut, they receive the Read to Grow welcome packet. And that includes the book, Welcome to the World. And if you had a baby recently, or someone you know had a baby recently in Connecticut, chances are they got the Welcome to the World book, or the families you serve, they've received the Welcome to the World book. We do distribute the book in English and Spanish. So they get the book in the hospital. They get more information about how to plug into getting more books for their child, the importance of reading. Even from day one, when that little newborn is in their arms, they can start reading to their baby. And they also get access to more books if they'd like. And then it sort of splits in terms of where they can get more support as their child gets older, right? They may be going to a pediatrician who is partnered with Reach Out and Read, and Alex will go into that model. They may be going to a child care center where they've requested our bookmobile to come and visit so their children can board and get more books. Any family with children in Connecticut can request books from Read to Grow as their children get older. And then there's a number of other ways that families can access free, high-quality literacy resources for their children. But this continuum, again, starts prenatally. And our sweet spot, I think both orgs, is that birth to 5 space, hence our presentation to this group today. I also just wanted to lay the foundation for why we do this work really quickly, Alex, if you don't mind just scrolling down a little bit more. Keep going until you find the map with the red. Here we go. So it'll take a second. Yep, go back up. There we go. So here's Connecticut. The map is laid out by school districts. And so the color gradation is about the kindergarten readiness. So when children come into kindergarten, as you know, teachers are required to assess them using the KEI, the kindergarten entrance assessment. And the darker the red on this map, that indicates a district where there's a higher percentage of children coming into school at a low level with their literacy. When we map poverty on top of that, and that's what the yellow circles represent, the bigger the yellow circle, the higher percentage of families who are at or below the federal poverty rate. You can see there's some alignment there between districts with low literacy and high poverty. And then there's some districts where it's not evenly matched. You know, our work is cut out for us here across the state. So Alex, we can go back to the main slide show and proceed with moving on to the Reach Out and Read model.
Well, thank you so much, Susanna. And I want to just jump on everything that Susanna has said is incredibly important in sort of setting the stage for what does early literacy look like as a continuum across the state of Connecticut. So we work very closely in partnership with Read to Grow to make sure that kiddos from prenatally all the way through age 5 have access to and supports around making sure that their families have the resources that they need in order to support their child's growth and development in this literacy space. So here we have what our mission statement is, and we strengthen all of our families and young children through guidance from medical clinicians about nurturing relationships through shared reading. And we envision a world where every child has the relationships essential to learn and thrive, and focus on historically under-resourced children and families across the country. So that map that you saw from Susanna earlier that showed areas of poverty and low literacy are areas that we at Reach Out and Read focus on. Now, our model specifically works with the pediatric medical home. And so these are the pediatricians and the family medicine doctors that you would go to over and over again as the parent or caregiver of a young child. So upwards of 14 different times that you'd see your pediatrician between birth and age 5. And those repeated visits to your pediatrician are areas that we operate in as Reach Out and Read. And so our model is one in which we actually train the pediatricians and the family medicine doctors, the nurse practitioners and the physician's assistants to make sure that they have the language to be talking to parents and caregivers about the importance of early literacy and how parents can engage with their children to make sure that they're developing appropriately and that they have the resources that they need to make those kinds of literacy connections with their children. And so here is a graphic that we have about what our model is. We work with our pediatricians, like we said, to talk to parents about the benefits of reading aloud, to show them how to look at books and how to talk to their to their children with stories in those books, to encourage them to cuddle, read up, read together at home, building routines. And during the exam, the providers will actually use the book as a developmental surveillance tool to help them observe how the child and the caregiver interact with each other, and also to flag if there are any developmental delays or challenges that they need to be aware of, that they can work with those parents or caregivers to make sure that those kids have access to additional supports or higher tier interventions to make sure that every kid gets what they need, regardless of who they are or what community they're coming from or what challenges they may face. And so that's an important part of what it is that we do. We want to make sure that we're tapped into those spaces and those referral areas that are supportive of making sure that kids get interventions as early as possible if they need those. So why does early really matter? One of the things that we'll talk about, and we'll start pretty broadly and then zoom in on some of the depth and the complexity about this, but in general, brains, especially brains in early childhood, are built up over time from the bottom up. It's an ongoing process that begins, as Susanna said, prenatally, and scaffolds upon each other. So when we start to look at brain scans, actually, in a few slides from now, you'll start to see the complexity of that brain develop over time. And we want to make sure that we're doing as much as possible to support in the early stages to make sure that kids have the foundations that they need, that as we start to layer on more complex thoughts and more complex experiences, they have a foundation by which to build on. It's the foundation for all future learning, for all future behavior, and those experiences either provide a weak connection or a strong connection as we move forward in the future. Oh, there we go. We'll talk about this to present as an idea, but and we'll get into more detail in a little bit about how you can actually do this specifically if you're working with parents and caregivers. But one of the ways that we do this is through an activity called serve and return. It's the interactions between a caregiver and a child where we have positive interaction between someone that is responsible for a child and the child themselves. And so one example of this is if you've ever worked with a young child and you've made some conversation and you'd hide your face and you go, oh, where am I? Oh, where am I? And that experience is a serve and return, because in return, you'd also get the joy of playing peekaboo with a young child, and they see you and then they don't see you and then you come back. And those little interactions, those exchanges back and forth, that positive behavior helps to build that foundation. So every time we have those kinds of interactions, every time we're engaging with a young child, we're seeing their reaction and we're adding to those pieces, it helps to scaffold the developmental foundations that we're talking about that help to grow a healthy brain and help to develop positive relationships with a parent or a caregiver. They're so important. And here's one graph. Like I said, we'll talk a little bit about brain scans in a second, but this is a very this is a complex graph to explain a very simple idea. And the idea here is that a young child has the biggest capacity to grow their brain. And as we get older, it requires more energy and more intention and more thoughtfulness to make the same amount of changes versus a young child and the amount of effort that we put into that. And so basically what you see here in this graph is the yellow line is the physiological cost required to modify neural connections. What that's saying is how much of a lift or how much gain do you get from putting in effort in those serve and return kind of interactions. And the green line here is the brain plasticity that's influenced by experience. And so the idea that how much can your brain change through those kinds of experiences. And basically what this is saying is that this is saying the more that you do early, the bigger impact that it has. This is another slide that sort of talks about that as well. And we want to go into the brain development. I'll throw this over to you, Susanna.
Thank you so much, Alex. So I just want to dive a little bit more deeply into the brain development piece because we, both Alex and I, through our organizations, partner closely with obviously a lot of medical providers, but in particular Connecticut Children's. And a couple of years ago, Read to Grow actually launched a partnership with Connecticut Children's around the NICU. And so babies that are born preterm or sick who end up receiving care, long-term care in one of many NICUs across Connecticut, now receive books for their families to actually read to them. And why are we doing that? It ties into what Alex was saying. So I think it's always wonderful to see images of the growth of the human brain. And so we have some slides for our partner, Dr. Lanwala at Connecticut Children's. And, you know, you've got the brain. We know it gets bigger and more developed as it grows. I want to just draw your attention to the phase chart on the bottom right of the screen, where you see that blue word, myelination. That's when all of the synapses, the connections in the brain, are starting to strengthen. You may have heard of white matter in the brain. Myelination is part of that process. Those synapses are becoming stronger. How do they become stronger? They become stronger through interactions, those interactions that Alex was talking about. Alex, can you go to the next slide, please? So just another image of, you know, the significance of how quickly the brain grows. In the early childhood space, we talk a lot about brain development and how important it is, but sometimes we don't actually look at these images and remind ourselves of how incredible this component of development is. And so you can see this is different gestational ages of babies in utero, but also babies once they have been born, and how quickly the volume of the brain expands. Next slide, please. At Read to Grow, when we are working with the prenatal population, even before babies are in the NICU, we are giving the message to patients, expecting parents, that their fetus can start to hear their voice and other voices in the environment around 20 to 26 weeks. That's when the hearing development really starts to solidify. We have a phrase at Read to Grow, read to your belly. So we're providing books to families to start that reading process and that bonding process even before baby arrives fully born. Let's go to the next slide. So once baby's born, let's say they do end up in the NICU, and that power of the human voice, I just want to spend a second on this. So our partner, Dr. Lanwala at Connecticut Children's, has done extensive research on the power of exposure to the maternal voice. And they're starting to do more research on just exposure to the human voice in general in the NICU setting. But when babies are in the NICU, only 4% of the sounds they are hearing is the human voice. The rest of the sounds they are hearing are the machinery, the loud, very loud noises to very tiny babies. And so it's really important to have a simple intervention like a book, encouraging people to read so that that human voice percentage goes up. What have they found when babies have more exposure to human voice, specifically maternal voice? Their cardiorespiratory, their heart rate stabilizes, their oxygenation levels go up. Non-nutritive sucking, what does that mean? That means when they're feeding. So they begin to develop those muscles that they need to have to feed. It strengthens that activity. When they hear a human voice, they start to move about. The other thing that starts to happen is that there is a preference for faces, for babies to see human faces, especially when they have that exposure early. And over time, they're starting to really show the impact on cognitive development. Even tiny, tiny preterm sick babies that have exposure to the human voice and language early on show better outcomes long term. We know that babies who are born in the NICU, it's about 10% of children in Connecticut were in the NICU at some point, maybe for a couple of days, maybe for many months. We know that it largely impacts folks who are struggling financially, racially, right? There are a lot of forces at play that cause unfortunate situations for families when their babies are born. And so this is a really critical part of our population, and the impact as the child grows older is really important to consider. Alex, you can go to the next slide.
If I could just jump in real quick, Susanna.
Sure.
To bring this to sort of a personal note, one of my closest friends recently just had a child born at 6 months and 24 weeks, and it was unexpected. They were planning on having the kiddo much later. And when they describe and talk to me from the perspective of a parent, they say that there is this feeling once they've had the kid of just being helpless, of not knowing what to do, of seeing all of the doctors and the nurses come in and out of the room, of doing all of the things with their tiny preterm baby, and not knowing what there is to do in order to support somebody that they just brought into this world. And so what Susanna's program and Read to Grow and the NICU work does is it makes real the tangible things that we know that you can do for a kiddo in the NICU, and gives some power and some sense of control to those parents and those caregivers who otherwise feel helpless in connecting with their child. And so one of the things, and we'll talk about this in a little bit, about things that we can do is sharing the consistency of that message across all of the families that we work with. And so we know that there are families out there that may have an older sibling, and that older sibling, they know what to do with that older sibling. Maybe that kiddo was a more traditional birth, and they don't have the resources for something in the NICU, and you're still connecting with them because you engage with them through the child care system. You can be that connection for them to tell them that there are things that we know that science has told us that you can do. And it's being there, it's reading to your child, it's talking to your child, it's having your child hear your voice. And the more amount of time that they can hear your voice and know that you are there and make those kinds of connections with them, science is telling us, the research is telling us that is critically important. Even for kiddos who are in the NICU that are preterm, that continues to be incredibly important. And there are things that you can do to engage with your kids, to engage with your families, even in the NICU.
Thank you, Alex. Can you go to the next slide? This is just to reiterate the brain development piece. So you may or may not be surprised to know that when they studied infants who had exposure to language, it showed that their left part of their brain developed more complexity and more volume the more exposure they had to routine maternal speech in the NICU. So literally grows their brain. We say it all the time. It's true. When you say that, you are telling the truth to the public. So I think we can go to the next slide, Alex. And the next few slides are lovely photos that reiterate our programs across the state. All right. So you saw the slides that I had presented at the top of the presentation when we were talking about Read to Grow's and Reach Out and Read's continuum of services within the prenatal to 5 space. And Alex, I think maybe I will actually share my screen just for the map part because it can get a little complicated. So I'll just switch over and then we can switch back after. So over the last year, Read to Grow has been embarking on an extensive data mapping project. I know many of the folks on this call have been on other presentations with me or my team around some of this work. And so I'm not going to spend a super long time on this, but it is in development. It's not quite ready for public, for folks to use this map for your own purposes, but that's a process that we're working on for the coming year. But I did just want to show you the power of data mapping when we consider early literacy in Connecticut. And so, you know, we've got, here's Connecticut. You remember it's by district, right? Darker the red, the higher, the lower the level of literacy for the higher amount of children. When we look at, just going to spend 1 second on Read to Grow programming. So from a medical perspective, if you look at this part of the map, you see the blue H's. Those are the hospitals we currently partner with. The red dots are families who've had babies at those hospitals who've opted in to get more literacy resources as their children get older. So you see there's a decent amount of engagement across the state from the early stages. When we go to some of the other maps, we've been able to pull publicly available data from a number of sources to get some other data points. And so when you look at, you know, specifically education by district, you can really drill down into third grade reading levels. You can drill down into demographics within districts. I am just going to show you something kind of cool here. I'm going to pull up Hartford, and I'm going to pull up East Hartford and West Hartford. And when we look at these three districts side to side, first of all, you can see the disparity in children who are living right next to each other coming into school with their different levels of literacy. The yellow dots are Read to Grow programming, so kind of ignore that for a second. But you know, we can see at a glance, where is the need the greatest and where do we need to really focus our attention? When we look at the other publicly available data around, you know, poverty level, limited English, households with no internet, food insecurity prevalence, you know, there's a number of social determinants that need to be brought into the conversation when we're really thinking about serving our community and the best way to reach them. So we have this tremendous tool now. We also have a legislative map. So legislators can go on and really look at their district and look at what's happening in their district as they're starting to make decisions about where the investments need to be to serve children and families. I think another piece of this mapping is really working with the other literacy resources in Connecticut to do a full map of who's doing what and where and how are they doing it. Because we know that there are, you know, statewide organizations like Reach Out and Read and Read to Grow, but then there's also the local organizations focused on literacy. We also have our wonderful library system. Both Reach Out and Read to Grow are partnered with the state library system. We do a lot of different programming through libraries and showing up with bookmobiles, partnering to get the word out about access to different types of programs. So more to come with the data mapping, but I did want to show everybody this initial work that we're doing to really help us make sure we're doing the work in the right places. So I will stop my share here, Alex, and hand it back to you.
And let me confirm, you can all see the slide deck. This should be
Yes.
Read to Grow in the Early Literacy Data Hub.
Yep.
Amazing. So one of the things that we also wanted to dive into was giving all of you a little bit of insight into what is a sort of a current conversation that's happening among the education community and the early childhood and early literacy community about this idea called the science of learning. And so there has been a tremendous push over the last several years to understand and better communicate the research and the science behind how language is acquired and how that process happens between the ages of birth and third grade. Now, we know a lot of communication coming out about third grade as one of the sort of cornerstones of understanding some of the data around future projections of test scores. And so, for example, in third grade, ELA, English Language Arts, and math test scores are correlated, and the strength of those test scores are correlated with a lot of different things like success through the rest of the middle school years, graduation high school rates, college acceptance rates. But we actually know that these are also correlated with long-term health outcomes as well. So your cardiovascular health, your mental health, the way and the amount of learning that we can make sure that happens in children in their early ages are directly tied to so many things as your kids grow and develop. And so one of the things that we wanted to share with you all, because we knew that there was going to be a lot of childcare folks here, is what's going on with this current debate and how can you help to pick up some of the baton on pieces that kids and families are getting in their doctor's visits, in their pediatric visits, in the hospital from day one, and how can we consistently make that message more clear about what folks are getting so that you all can share a similar language and that parents can get consistent messages as well. And so what do we know about the science of early literacy? We know that there are two major components when we think about the science of early literacy. And one of those components is skill development, which we'll dive into. And one of those components is the language environment. So we're talking about the difference between breaking down the specific mechanism of how folks learn how to break down words and phonics and fluency, and the environment that they find themselves in. How many words do they hear? What kinds of words do they hear? Both of which play a huge role in making sure that kids get what they need in order to develop language appropriately. And so as we think about this, we think about that first distinction, and here's an example of code-based and meaning-based skills. We've got in here a sort of a passage from A House for Hermit Crab by Eric Carlisle. And it goes, "In April, Hermit Crab passed a flock of starfish moving slowly along the seafloor. 'How handsome you are,' said Hermit Crab. 'Would one of you be willing to decorate my house?' 'I would,' signaled the little sea star. And carefully, Hermit Crab picked it up with his claw and put it on his house." Now, as a child reading this, one of the words that you may have a challenge understanding is, how does the word flock fit into this conversation? How are they supposed to understand it? How are they supposed to pronounce it? How do they incorporate that as part of their development in understanding reading? And so on the left-hand side, you start to see how you would break that down, how the sounds and the consonants and the vowels make up that word. On the other side is the cognitive strategies, the vocabulary that's required in order to understand this passage. How do you understand that the English word pass, has 85 different definitions, and which one applies in this instance to make sense of the passage as it stands? This is the difference between those code-based skills and those meaning-based skills that we were talking about at sort of the top of this section. How do you understand what phonological awareness, so what that is the breakdown of the word itself, and how does that compare to the vocabulary or the comprehension or the conceptual knowledge of how kids understand the world? And those two pieces in our first category become incredibly important. In the second category, we start thinking about the quality and quantity, the amount of words that are heard and understood between the continuum of infant and prenatally, like Susanna had talked about, all the way through third grade. So this is an example here of the number and amount of words and vocabulary that exists along the continuum of development. I put this slide here to sort of give an idea about the major impact that this has. The gray in this pie chart is all of the other factors related to language development besides everything that we are talking about. And so this is nutrition. This is whether or not there's parenting stress. This is genetic factors. This is an appearance of ACEs or adverse childhood experiences in the home. This is poverty. All of those are influences into how language is developed for a child. Now, it's a big part of this circle, but it's not the whole of this circle. And so we can't let those outside factors be determinants in and of themselves for language development, because what we see here is that the quality of how we engage our language environments is critically important, even more so than the quantity. And so you may have heard the research that kids hear 30 million words by the time that they turn a particular age, and that there's a word gap in the amount of words that some children hear between a particular age and between different poverty levels. And I'm trying to tell you that that is true and that does exist, but that is actually a smaller part of the pie. So if you were to just read the dictionary to a young child, it doesn't materially make as big of a difference as all of the things that Susanna and I were talking about earlier, about those kinds of quality level engagements with a child, the serve and return, and the dialogic reading that we talk about in the pediatric office and the family medical office and in the hospitals that Susanna is talking about. So I want to zoom in a little bit on the practice of what's called dialogic reading. Dialogic reading is something that we train our physicians, our nurse practitioners, our physician's assistants on. And it's a strategy where you utilize conversation to engage a reader in the text, in the children's book's text, rather than just reading passively to a child. This is the idea of we're not just reading a dictionary to kids and assuming that they assimilate that knowledge. We're trying to engage with them in a conversation so that they get a deeper and more quality experience with that text, where you read with them instead of talking to or at them. And so there are specific strategies for how you engage in dialogic reading. One of these is an acronym called PEER, the PEER sequence, where each letter of PEER stands for a process that you can do and that you can engage with while you're reading to children. So one is to P, the P stands for prompting the child to say something about the book. E is evaluating the child's response. The second E is expanding on the child's response by rephrasing and adding information to it. And R is repeating the prompt to make sure that the child has learned from that expansion. And so what it actually is it's the idea of scaffolding and engaging with a child, asking them questions, hearing what those responses are, and building off of that in order to make the text more engaging and more complex and more comprehensive. I wonder if this is going to work. Let's see. Here's an example of dialogic reading. I hope you can hear this. Please tell me if you can.
And broccoli, is that, so tell me some of the vegetables or fruit that you would buy if you were at the store. You would buy carrots. Which one are the big carrots? Where are the big carrots? Right there, you buy the big carrots. What would you purchase if you were at the store, Eli?
I'll buy garlic, eggplant, strawberry,
You buy a bunch in oranges. What would you? In watermelon, those all sound good.
So I share that tiny little clip. Whoops, maybe I didn't share. Let's go back to here. Let's open that up. Let's get out of YouTube. Maybe I can't get out of YouTube. There we go. And back to our slide deck. I share that little bit because I want you to see that the educator here in this classroom isn't just reading from the book. She's taking a moment to stop and look at the picture and ask questions about what the kids see, to talk about the text, but then to expand more deeply into the text. And some of the ways that you can prompt a child in the text or in the pictures as you're engaging with them is another acronym called CROWD, the CROWD acronym, which stands for the C standing for completing prompts, the R standing for recalling prompts, the O standing for open-ended prompts, the W standing for WH prompts, and the D standing for distancing prompts. So, for example, you could say something like in that grocery store or that shopping, what you saw the educator do there was, what we're going shopping. What do you think the main character here would be shopping for? They'd be shopping for a, and then they could say something, and then that would be, like we talked to at the top of this conversation, the serve and return engagement. And so here we have different examples, and I realize some of the bubbles are a little bit different. So if folks have questions about that, we can put that in the chat or send that out later. But here are different examples of what you can do to engage with folks in a back and forth. And we just wanted to share some of that with you because those are the same kind of tips and tools that the families are hearing in the doctor's offices and in the hospitals that are engaging with the Read to Grow and the Reach Out and Read program. So last but not least here, we wanted to put out just some things that are on our radar as nonprofit literacy organizations that we are keeping an eye on that have an effect on our ability to promote literacy at the early childhood stage. So here are all of the things, and this is an incomplete list because this changes on a day-to-day basis, but we want to flag for folks that any one of these is going to affect our ability and probably your all's ability to deliver your work in complete and comprehensive ways. Medicaid. So for those of you that are unfamiliar with Medicaid, Medicaid is a health insurance program specifically for folks who may have a disability or may be experiencing poverty or low income. Medicaid pays for a tremendous amount of health insurance for folks across the state and across the country. Almost 40 to 50% of state budgets across the country are either revenue, expense, or expenses come from Medicaid. Currently in the federal government, there are some pretty wide-ranging Medicaid cuts that are existing that would have some pretty significant impacts on the healthcare sector. If those cuts go through, which we're anticipating at least some of those cuts to go through, we don't know the impact on providers or clinicians or hospitals, and our impact or our ability to make sure that kids and families get the books and the resources that they need could be challenged. HHS stands for Health and Human Services. Health and Human Services is a federal agency, and currently the federal agency is undergoing a pretty dramatic reorganization and a reduction in force. And so the resources that we have been able to lean on to help us tap into areas of additional support like SNAP, like WIC. SNAP is food stamps. It's a supplemental nutrition program that is also on sort of the chopping block in the next federal government. WIC is the federal program Women, Infant, and Children, which provides health and nutrition support to pregnant folks. And the reorganization of the vaccine conversation and the support that the AAP and sort of the CDC are going through are all experiencing some pretty significant cuts. We don't know to what effect that will have on our medical and practicing community. The dismantling of the Department of Education, we partner very closely with federal agencies and state agencies as well. The resources and supports for that remain sort of questionable, and we're sort of looking into the impacts of what a reduction at the Department of Education would look like. There have been some conversations about organizations that speak out using particular language like diversity or inclusion and inclusionary language. Reach Out and Read, and I don't want to speak for Susanna here, but they do really strong work as well. Reach Out and Read has made a sort of formal and external statement that we are not moving away from supporting both an equitable distribution of resources as well as our support of authors and publishers and publishing houses of color to make sure that there's as much representation for the populations that we serve, as well as the books that we distribute at pediatric sites. And as a response to that, we are keeping an eye on whether or not the sort of federal government through its taxing authority is looking to remove the nonprofit tax status of organizations that engage in diversity, equity, and inclusion work. So we're keeping an eye on that. And diversity, equity, and inclusion as sort of a broad swath. There have been a number of executive orders that have explicitly targeted specific words. And so how does that impact our work as an organization that works to expand opportunities in areas that have been traditionally underserved through books and resources that celebrate the differences that we have as a people and as a community. And so we're working to see to what extent we are going to be restricted by the federal government as we engage in that work. Susanna, did you want to talk about either this and or the state line item piece?
Sure. I'll just mention along the DEI piece, Read to Grow remains committed to providing resources, high quality resources to families that reflect the families we serve, as Alex said. What has changed for us is how we support our staff in going into communities and where they are actually encountering not a high percentage, but some amount of pushback. We've had situations where people have boarded our bookmobile and made derogatory comments about books that feature characters of color. And we've had folks question why we would want to provide those to families. And so we've been supporting our team in responding when that comes up and really making sure that all the families we serve feel respected and heard and safe when they access our resources. To Alex's point, we were included in the last budget through the state library line. The three organizations, Reach Out and Read, Read to Grow, and the United Way of Central and Northeastern Connecticut, to continue this work. And it was removed and then put back in this last budget cycle for the next 2 years, for FY26 and FY27. It's $500,000 total each of 2 years, split 3 ways between the organizations. So that's about $166,000 to each of our organizations. That is a portion of coverage for the work that we do statewide. And so as we move forward, when we think about what is the true cost to make sure that all children between the ages of birth to 5 have at least multiple touch points to receive books to take home and some kind of high quality engagement around literacy with their caregivers, whether it's their parents, other family members, or the other adults taking care of them. We have been putting numbers to the page as we look forward to, I think somebody in the chat, Michelle Levy, mentioned the OEC plan for statewide early literacy. So we're eager to continue this conversation and visioning about what it takes to make sure that all children have access to these resources. Ways to engage with the work in Connecticut. So I saw in the chat, I was heartened to see so many folks saying, hey, I got the book when I had my kid in the hospital, or the bookmobile is coming to the Southington Early Childhood Collaborative. So there are many ways through Read to Grow specifically where both care providers can access our resources. You can request books for the children you serve. You can request the bookmobile to come and visit. Be aware, it's scheduled out months in advance. So at this point, put in your request for the fall and the winter. And then if you are working with the really young population, if you're in infant toddler care, making that connection for families, because you may be able to say, hey, did you get the Welcome to the World book? We're happy to give you copies of the Welcome to the World book if you want to use that as an anchor in your childcare space, because then you'll know families have this book at home, and that's a starting point for conversation about reading to their baby. Again, lots of ways to engage directly. Also supporting literacy when it comes up as a legislative priority, when we are having conversations about the full spectrum of high quality services that children need to be successful. literacy is certainly a really important component of that. And so being an advocate for it is, the more of us, obviously, the better the outcomes will be. So I'm going to turn it back over to Alex to wrap us up here.
Yeah, and the only thing that I would add on the Reach Out and Read side is if you're working directly with parents or caregivers or families, ask them if they're receiving those books at the hospital, if they're receiving those books at their pediatrician's office, and encourage and engage them to read to their children dialogically and serve in return. Teach them those skills because if they're seeing a pediatrician or a family medicine doc that aren't engaging with one of our programs, they won't have the tools or the skills like this, and you may be one of their only access. You may be their only access to getting some of that information about the importance of reading and engaging with your child. So thank you very much. That is the end of our that's the end of our presentation. I know we have a little bit of time for some questions. Izzy, I don't know how you want to do that, but please feel free to guide us.
Sure, sure. I'm going to call on Ava first. Ava, your hand's raised. Did you mean to do that?
Yeah, I did.
Okay, great.
Sorry, the tech here. So I have a question and a point of clarification. So my first question, well, I guess clarity and then question. The audience that you're speaking to here in Early Care Connection are childcare providers who have a childcare space. They own or operate a childcare space. You mentioned the ability to retrieve and get books. Is there a limit to how many books they can get to pass out to the parents that are in their care? So if you can clarify that, and then I'll ask my question.
Sure. Yeah. So we accept requests for, anybody can submit a request, and then we evaluate our ability to match the request based on each individual request that comes in. Sometimes folks ask for thousands of books. We can't match that type of request. But certainly if there's a childcare provider who is requesting books for their classroom or books for their particular program, we make every effort to make that happen. That's also, there's an opportunity there for the bookmobile to come and visit, for every child in that program to board the bookmobile and get a book. But within reason, we are typically able to meet the requests that come in.
And I'll jump in to add that while we don't have a program that distributes books to childcare providers, one of the things that Reach Out and Read does is, because it's a national network, we have a large purchasing power within the publishing community. And so we organize what they call a Book Buddies program. One of our affiliates organizes this and works specifically with publishers to get low-cost children's books. I think the last time that we had that was somewhere in the $2.50 range for book. And so one of the things that we could do is we can coordinate some of the outreach from childcare providers to see if we can get folks onto those lists to get them access into some of the purchasing programs that we have to make sure that we can get those kinds of resources out to kids and families.
Great. I know Merrill has some questions, but before I turn it over to him, can you guys just put your best contact information in the chat, if you don't mind, because there are a number of people asking how they can reach out to get trainings for their staff. So whoever you think is best to put in for that. Merrill?
Yeah, I was just going to suggest that training on dialogic reading would be great for early educators. Shut up and let me read the book is not the right approach. We really want to have kids engaging with that. And, I think any experienced early educator knows that, but there's certainly a lot of turnover, lots of new staff who are coming in. And I think that's really important. I always remember back to doing a training with foster parents in New Britain and asking them how many of them remembered anybody reading to them as children. And out of a group of about 20 foster parents, there was like 2 hands that went up. And we did this fun exercise of splitting them into 2 groups, one being the the parent and the other being the kid, and having them practice reading to each other. And it was so fun watching the adults who had gotten the kid role kept interrupting and asking questions about things, and it really flustered the parents, the ones who were reading and didn't quite understand how to do that dialogic reading. But that kind of some training to help early educators understand that, so that they can be modeling for parents, would be great.
It's a great observation, Meryl, and I'll only add that I'm sure that folks in the childcare space are struggling with this the same as pediatricians are. The battle for screens and attention is a tremendous challenge, and the temptation to just stick an iPad in front of someone and call that engagement, whether that be something educational or not, it doesn't develop the kinds of engagement and brain development that Susanna was talking about, that we're trying to encourage. And so, yeah, absolutely. The dialogic reading training and ways to encourage parents to engage with their kids, even if they're interrupting, or all kinds of things that our youngins do.
Thanks.
of course,
Ava, did you have another question? Yep, go ahead.
I was gonna say, of
Oh,
course,
I'm sorry, Meryl, did you have a follow-up?
just the obvious way to easily train lots of people is with a screen and have a video that shows them how to do it.
Right.
Yeah.
That's exactly actually what I was thinking, and I was like, oh, maybe that's beside the point, but you're right about that. Yeah, Ava.
I'm curious how you're handling ICE raids, fear about ICE, fear about undocumented families or mixed status families. A lot of the families that providers serve in urban areas interact with families who are mixed documentation, and we do have a good handful of providers here in the state who are legally and wonderfully providing childcare. But they're childcare providers who are undocumented. So the interaction with the bookmobile, how you're dealing and making sure there's accessibility. And then the tag on to that question is, what is your interaction with the books that you serve, multilingual, multi-language, to really embrace the different cultures that are represented here in Connecticut?
Great question. So we provide books in over 13 different languages. And our prenatal care providers actually are the best resource on what languages are in each community. And so we really try to tailor even our bookmobile stops. Part of the intake form is what languages are spoken by the families you serve, so that we can make sure the inventory available for children to pick is representative in more than just who's in the pictures, but how the words are written, so families can share stories together. In terms of the ICE raids and the fear of being in public, so we have seen really real impact, particularly with our partnerships with food pantries and diaper banks. Those partners we go to a lot, either through our Books for Kids program or with the bookmobile. And initially, many of our partners with food pantries and diaper banks were seeing a decline in families coming out to access resources. We also saw that obviously in childcare spaces where families were not bringing their children to school or childcare because they were afraid that that would be a site for being targeted. Some of our partners have started to see an uptick of families coming back. We follow the lead of the partners. So if they don't want it to be publicized, we don't publicize it. If they, there's lots of different ways that community partners have had to become really creative to get the word out to the folks who need these resources the most. And so we follow their lead. And again, it also goes back to our team being trained to be responsive in those situations, and to make sure that they're working in partnership with our partners when they go to sites where the fear level is really high.
The only thing that I would add to that is, and I don't want to speak out of turn for on behalf of the medical community. We do know that many of our partners, and we follow the lead of our partners, In the healthcare world, documentation status is not a part of intake or the medical exam for pediatrics. And the AAP has released a statement about the interaction with ICE and immigration that is specifically, I'm going to drop that into the chat since we follow the lead of our partners and the AAP is a big partner, so that folks can have access to what, excuse me, the AAP is the American Academy of Pediatrics. And what our partnership has said about ICE and masks, right? ICE and detentions.
Right. Ava, last question before we wrap up.
Should I take it? Okay, I don't want to monopolize. My last question is, what's your interaction with the app that OEC sponsors called Sparkler? So a lot of the information you presented today has to do with development and brain development. The providers on this call are all very well averse to that reality. They're educators, but they also use and have been asked by the Office of Early Childhood to promote the Sparkler app. If the mission of these two organizations in literacy is to really connect the synapses, the brain growth with looking at those benchmarks, how are you as an organization or organizations taking advantage of Sparkler and the opportunity for parents to notice that there's something developmentally wrong, or what are those benchmarks? What are, what are the telltale signs of you're doing well, you're doing bad for a child? So I just wanted to see what that relationship was with Sparkler.
Sure, I can go first. So Read to Grow has been partnering with Sparkler for the last couple of years. So we include Sparkler information in our prenatal packets and our newborn packets. So any family that gets those packets gets information about Sparkler with our Read to Grow code, so we can track who's hearing about Sparkler through Read to Grow. We also have partnered with Sparkler to do the Read Across America week readings. And so for the last 2 years, we've worked with authors across the state to do read alouds and activities. It's a nice partnership. It makes sense, and it's a shared resource. Families who opt in to get more books from us fill out an intake form and then get a welcome email. And in those email communications, we include more information connected to Sparkler. We're working on developing a few more email templates that include the milestone markers that Sparkler emphasizes, and little reminders that they can log on to their app if they have questions about their child's development. But it is a great relationship, and we've been working together for a while.
Great. Thank you so much. I think that is our time, and really appreciate Alex, Susanna, Allison. Thank you so much for being here with us today. Thank you to CT359 for setting this up. And of course, all of the work that you all are doing to keep our kids not just literate, but engaged, brain growing, socially healthy, emotionally surviving. I mean, everything comes back to these kinds of engagement. So really, really appreciate the work that you're doing.
Thank you, Izzy, and thank you, Susanna and Alex. So great to see you.
Thank you, Allison and Janice and Meryl, Izzy, Eva. Thank you.
All right, have a good one. Okay, so Meryl, I'm going to turn to you for a federal update.
Okay, so this is a key week in Congress. The goal of the Republican majority in Congress is to try and pass the big, beautiful bill by the 4th of July. This is a reconciliation bill that enables the majority to push something through the Senate with just a majority vote, as opposed to the supermajority that you need to prevent filibusters. And so the House passed one version. The Senate is in the process of trying to pass its version. There are some differences between them, and both of them would make large cuts to Medicaid, the Husky program as we know it in Connecticut. estimates are anywhere from about 150,000 to 275,000 people getting cut off of that program. And they do it through a bunch of different ways, one of which is to have work requirements and lots of reporting. So there's maximum opportunity for people to mess up the paperwork and get cut off the program. These are for adults up to age 64. So you have to be working, you have to fill out your paperwork every 6 months or something, prove that you're working. And that means that folks who have a disability and others, frequently they get cut off even though they're eligible. Really what this is using administrative burdens to make it hard for people to stay on the program and therefore reduce the amount of money the federal government spends on it. There are also things about penalizing states that provide care for undocumented people. There's a whole bunch of bad stuff in this bill. One additional thing that showed up in the Senate Finance Committee bill is something that would prevent people from getting student loans for degree programs that the graduates of that program don't earn a lot of money. So if you are going for a degree in early childhood, for instance, and the wages of people from that bachelor's degree program are not the equivalent of the median wage for high school graduates, then the program becomes no longer eligible for those student loans. Since early childhood is one of the lowest paid fields in the country, there's real potential that early childhood programs could no longer be eligible for student loans. And so this is something, along with the Medicaid cuts, along with the SNAP cuts, things that members of Congress need to hear about this week. So if you can make a phone call, I mean, our congressional delegation is all going to vote against these budget proposals. But to the extent that you can make particular parts of this more important to our delegation, so that if they happen to be talking to someone on the other side of the aisle, that they've got that story about, most people haven't really focused on this issue of early educators not being able to take out student loans to get a degree in early childhood, because it doesn't say early childhood in the bill. It talks about sort of this seemingly sane idea of we shouldn't give student loans for people to study in a field where they're not going to earn any more money than if they just had a high school diploma. Sounds fine. I mean, we shouldn't really be spending money training people to be, to make buggy whips. If there's no market for buggy whips, why should the federal government be lending money to people to study that? Well, it's fine if you think about that, or you could, think about it in terms of like AI is going to replace a whole bunch of jobs. Should we be training people for jobs that are going to be replaced by AI? It sounds reasonable. In this case, it's going to have a real impact on early childhood. So
Yeah, they actually have to fix the childcare sector.
Yeah.
Because it falls into this category of totally not making any sense at all for anyone to be in the field, which we agree on.
Yeah.
They haven't set it up so that people are making enough money to do this job. So that's exactly why we're all here. Is this also a good time for folks to, call your cousin in other states and say, if you haven't called
Yes.
your Congress people, your representatives,
Right.
should we be targeting? It's the House they have to target? I'm sorry.
It's the Senate first, because they are the ones that have to pass a bill. Then there'll be a reconciliation,
Right.
trying to make the two bills the same. I'm going to just share out a link that is how many people will be cut off of Medicaid by state.
Yeah, so like my dad lives in Pennsylvania. I'm constantly calling him and saying, there's a lot of things that will be affected. Call your senator and just say, I really want you to take this into consideration. So, you know, if there's people that you know in other states and that you can ask them to make that 1-minute phone call, it's a good time to do that. All right, you all set, Meryl, or is there any more?
Yep.
Okay, turning it over to you, Ava.
Hey everyone, childcare for CT is not stopping a beat after our legislative victory with the coalition getting universal childcare and other amazing things. But in order to keep the pressure and prepare for those federal budget cuts, it means that we have to still spread the word. Spreading the word and the goals on what we're trying to do this summer. Twofold. We want to make sure parents and providers know about the legislative victory and what it means to them, what the impact will be. And we also, like I mentioned, want to prepare for those federal cuts that are coming and make sure that come next legislative session, we have an army of parents and providers ready to advocate and really make sure that the funding that we got that's new doesn't evaporate, doesn't go away. So we are tabling, we're going to festivals, events this summer, and interacting with people one-on-one. We were just this weekend at the West Hartford Pride Festival. It was amazing. We had over 20 signups from parents. We had about, a handful of educators who are also unaware that this happened. But if you are wanting and willing to help us table and be there, an hour or two, spread the word, have fun, grab some real cool tchotchkes with us, then let us know if you're available. If your summer is too crazy because you're educators and it is near to impossible to get away on a Saturday or a Sunday to table, that's okay. Let us know if there's a festival near you. So we are Googling and researching to try to figure out different events that are family friendly that are happening that we can go to, but who better to let us know what's in their community than all of you. So you can put some information on the chat right now, or if you want to give it some time to think about what festival is near me. Is there a blueberry festival? Is there an onion festival, a garlic festival? We all have all those types of festival here. If you think it's family friendly and a good place for us to be, Childcare for CT, then put in the chat, let us know, and hopefully we'll see you at a festival this summer.
Awesome. Okay. Meryl, one more thing.
Yep, I forgot to mention that the Alliance is doing a listening tour. We're going out and talking to lots of childcare providers this summer. And if you would like to schedule a visit, just drop Vanessa an email, and I'm sticking her email address in the chat.
Fantastic. Okay, so reminder to everybody that we're about to hit summer schedule. So we are, Vanessa wants you to fill out that document instead. Don't email her.
Okay.
Meryl, fill out that document instead. That will get to Vanessa and she can get right back to you. Then thank you so much. We're about to hit summer schedule. So we are having a call next Monday. We're taking off for July 7th, which is July 4th observed. And then we are every other week. That's what we decided to do. So every other week. We'll have the calendar on earlycareconnection.org updated. So if you get confused about the schedule, you can of course always go there. That's where you'll find all of the recordings as well. Earlycareconnection.org. You can click out to our YouTube, which is youtube.com/@earlycareconnection. But you can get to it right from the website, and the calendar is there as well. So any canceled dates, any summer schedule will all be listed there. And we're going to get that all, I think it's up to date today, but if it's not, it will be up to date this week. It's just our little team trying to keep all of these things up to date. It's not that easy, but anyway, so great to be with you all this morning. Thank you, of course, to Sandra for providing interpretation. The recording will be up in the next 24 hours, and we will have both the English and Spanish presentations there for you to access. Thank you, of course, to our guests today and to all of you for being here. Have a wonderful week. I hope you all stay safe and cool, and we'll see you next week. Thank you.